The success rate on those is in the high 80s, low 90% success rate. And if you were a gambler, you went to the casino, you had a 90% shot of winning a certain game, I'd play that game all day long versus a 40% chance of winning on a back surgery. So I
Absolutely.
always say spinal decompression first, drug second, surgery last resort. Hello, everybody. It's Dr. Troy with another episode of Everything Disc, from pain to play. So today I've got a great guest here. He's coming to us from Sarasota, Florida, and he's down there in the sun. You got the flag behind you, and you're at a historical location. Dr. Thane, I want to welcome you to the show today.
Thank you.
And thank you for taking time out of your schedule. I know you used to live in Washington. Now you're living down in Florida. You've been working with Disc Centers of America, which is a group of disc center doctors across the country. I think we're close to 300 clinics almost now.
47,
And I think with you coming on board,
states. We just added number 47.
wow, 47 states. So this is great because, I can't tell you how many times patients come into my office and they say, why did nobody tell me about this? And they tried things, they tried different procedures and different medications and different things for years. They come into one of our disc center clinics and they look at us and go, man, this is helping me. Why didn't anybody tell me about this years ago? Dr. Thane, let's talk about decompression. Tell me a little bit about your story, why you got into it. And I know you were in practice almost 40 years, which we can glean a lot of knowledge from you. So tell us why you got into this and tell us a little bit about decompression.
Absolutely. It's actually a great story. I had several associate doctors that were working with me, and one of them was a female doc, and she had a horrendous L5 disc. I was trying to help her. Other docs, we were all trying to help her, and nothing we were doing was working. And like I said, been in practice for 39 years, and this was in 2005. And seeing her condition deteriorate, which I had seen with other patients, the first 19 years of my practice. And these are the kind of people, unfortunately, you end up sending, to the consultation for a surgery. And that's where she was. At the time, there were three of these decompression machines in our state. One of them was in Kirkland, and my practice was in Bellevue. She went up and saw this guy, and that was 20 years ago, and she's still in practice today. And this is the kind of patient that would have, she would not have been able to continue chiropractic. She probably would have ended up in surgery, and who knows where that road would have gone. So when I saw that, I was like, just dumbfounded, because I had been in practice for, almost 20 years. And these are the kind of people that, unfortunately, you do everything you can, but you end up sending them for the injection or where she had the surgery, and that's the route they go. And to see her have an absolute turnaround, and I'd seen so many people, in the past like her. Some of them you helped, but some of them just, they went down the road she did. To see that turnaround, to see her, the activity level she was having, I was amazed. So I immediately looked into it. I flew down to California. There was a doctor down there, was doing a seminar. So I went and I learned about it, immediately made the investment, got involved in 2005 with my first non-surgical decompression. I got a DRX 9000, and then I started to have miracle stories like her. And that's what got me into it.
Yeah, that's kind of what happened to me. I actually hurt my low back. I don't know if you know my story, but I hurt my low back, herniated 3 discs, and tried everything other than shots and surgery. And friend of mine, doctor, put me on his decompression table, and I instantly got off the table and I went, man, I'm going to get better. And I'd been suffering from chronic low back pain for over 10 years, being an athlete and bending over a table all day, taking care of patients. And I went, wow, this stuff
Ironically,
works. So
people don't know that chiropractors historically, we're bending over people. So even though you try and watch your posture, it's, 20, 30, 40 years of that, and you have problems.
well, typically, in my case, that's what got me into this profession, was an injury back in high school. I went to a chiropractor, he fixed me up, and that's where a lot of these chiropractors come from. Is they were helped with chiropractic, and they went, man, this is such a great profession.
Yep.
I want to help more people.
Yep.
So I know you and I have been to trainings, and we've flown across the country to different seminars. But what's, because I get these patients who come into my office and they're like, I've been to a chiropractor. And so, the biggest thing I have to tell them is like, listen, yeah, that's where we got our degree so we can practice, but we specialize in non-surgical disc herniation, disc damage, spinal stenosis, nerve compression, repair. So our technique's gentle. Can you talk a little bit about, people who think, oh, I've been to a chiropractor, and correct me if I'm wrong, Dr. Thane, but there are medical doctors, there are nurse practitioners, there's osteopaths, there's surgeons out there that actually have spinal decompression in their office. So it's not just a chiropractic thing.
Correct. Yeah, there are all a multitude of different positions, and some of our top surgeons in the country are huge proponents of non-surgical decompression because they realize that there's such a low success rate with surgery. And yeah, and the thing is, as you've talked about, even though the procedure's been around for 45 years, since 1985, not a lot of people know about it.
Yeah.
Especially chiropractors, medical physicians, they don't know much about the procedure. And one of the sad things too, and this is, you say I've been to a chiropractor, even people that have been to somebody who has decompression, the question I would always ask them, what kind of table did they have and what was the protocol?
Yeah.
And I hate to say
Yeah.
this, but there's a lot of people that, they go to a weekend seminar or they buy a true non-surgical decompression table. I'm just going to say it. It's more expensive. The engineering, the
Hmm.
technology, doctors that invest in that, there is a difference in tables. So you always want to find out what kind of table. I have patients say, I tried decompression, didn't work. Well, my next question is,
Yeah.
what table was it? What was the protocol? And I will commonly find
Yeah.
out, they'll say, oh, I went in once a week for 3 weeks. And it's like, whoa, wait a minute. There's no study that supported that. Uh,
Yeah. Yeah.
and as again, been to a chiropractor, that's great. Well, has an MRI been done? Has somebody assessed it, as you've said, from a disc component? And has non-surgical decompression been a protocol that you've tried? And has it been done with proper protocols that have been studied with true obtainable, quantifiable results?
Yeah. Well, it's interesting you bring that up because I had a patient just the other day that went to another office for a consultation and then came to us. And I go, is the doctor certified in non-surgical spinal decompression? And at Disc Centers of America, I mean, we've been getting certified every year. It's an annual thing. So we're up on the latest and greatest things to help discs get better. And we were just down in Florida recently. We had neurosurgeons speaking, we had neuroradiologists speaking, we had compliance people speaking. And so, this patient, I said, what did they recommend? She's like, oh, a couple weeks at twice a week. And I'm like, those aren't the protocols that, Dr. Shealy laid out, the Harvard trained neurosurgeon. And that's what the protocols that we follow. And the success rate on those is in the high 80s, low 90% success rate. And if you were a gambler, you went to the casino, you had a 90% shot of winning a certain game, I'd play that game all day long versus a 40% chance of winning on a back surgery. So I
Absolutely.
always say, spinal decompression first, drug second, surgery last resort. And at times there might be people that need that, especially if they have an instability or a malignancy or a serious fracture or they have conocoitus syndrome. But you know, nine out of 10, even my staff, I asked them, how many out of 10 get better? And they said at least 9 out of 10. The stats are probably higher. So it's safe, it's gentle, it's effective. I know you
By the way,
had a
me comment.
patient.
Let me comment on that. And, because there's always people like, well, what if it's not going to work? Can you guarantee it and all that? And, of course, any ethical physician will not ever guarantee anything. But what I always want to share with people too, if you understand the concept of what non-surgical decompression is, what you and I have talked about, the word we use is imbibition, which is fluid flow in and out of the disc. You're literally working to rehydrate, to revitalize, to restore the actual tissue of the disc. Yes, there are people that you never have 100% success. And there are people who've gone through decompression who do end up in surgery. But here's what I tell people. Even if you end up having to have surgery, in my opinion, and it's studying this for decades, you're better off going through non-surgical decompression procedure first because we are going to rehydrate your disc. 100% of the people, according to the Ironman study, showed that people had repairing of the outer annular structure of the disc. It is not possible to go through non-surgical decompression and not see some tissue integrity healing and to see an improvement in
Mhm,
circulation.
mhm.
And if you're going to go under surgery, the greatest thing you could do would be to increase circulation to that area to prep the tissue. So let's say you go through the whole protocol. Let's say you're still symptomatic. Unfortunately, you're in that small percent that doesn't get better. If you had to go to surgery, this would be the best thing you could do to prep those tissues to allow you the
Yeah,
greatest chance for a higher probability of result, a positive or a favorable outcome with surgery. So there's no downside.
yeah.
It's either going to work
Yeah,
or it's
no,
going to
yeah,
prep you to be able to have a better outcome for the unfortunate thing if you
yeah.
have to go to surgery.
Yeah, and I think, the smartest doctors I've seen are the ones that say, "Hey, let's do spinal decompression first, because once we cut into the tissue, we're losing tissue integrity, tissue strength." And my perfect example is Tiger Woods. He's on a seventh back surgery, and it just snowballs. It's you're taking away from your frame.
Yeah, and he's got the best ones around. So
Yeah, I mean, even the best of the best, top athlete in the world, 7 back surgeries later. And it's just, I mean, that's why I like to get on the shows and doctors like you with knowledge and just tell people, hey, here's the truth. Here's what you should do. If you were my mom, I had a patient yesterday. I said, if you were my mom, this is what I'd recommend. And she was super skeptical. I'm like, if you're my mom, this is what I'd recommend. It's up to you. It's your body. It's just going to get worse if we don't take care of it. Just like diabetes, if you don't treat it, just like cancer, if you don't take care of it. It's a chronic, progressive, degenerative condition, and we got to manage it.
yes,
Either you're going to manage it conservatively and holistically, or you're going to go down the medication and surgical route, which,
yeah.
those are options.
And once you cut, you can't uncut. It was interesting. I'm sure he probably experienced this too. I did not know in the 20 years I was practiced before that the FDA doesn't even approve epidural injections for the purpose of back pain, and that
Yeah.
blew me away when I learned that. Being certified, that's part of what we're taught, and to this day, most doctors or even physicians don't understand that concept, and it's crazy. I mean, there's what 9 million of those done a year in our country, but and it's commonly done. It's called an off-label use. They can do it, but it is not approved by the FDA because they found that it doesn't have a favorable outcome. So that's just a crazy statistic that just caught me totally off guard.
Yeah. And Dr. Oz has a quite interesting segment on that as well. And that's an eye opener if you
Hey,
watch that
I
one.
recommend that to everybody. Just get on Google, Google Dr. Oz and epidural, and sit down and take the 10, 12 minutes to watch that. You'll get a great insight
Yeah.
into the world of the epidural and with relation to back pain.
Yeah, and that's why I like to collaborate with doctors like you. Even at our last conference, we had a neurosurgeon. He's like, call me anytime," and I'd love to work with you guys. If they have a herniated disc, I always put them on decompression first, and then we can always do surgery if it's something that nothing else is helping.
Yeah,
But so many people are quick to rush to surgery without trying something that can help restore function naturally.
naturally.
It might take a little longer. You might have to manage the pain, but the results speak for themselves.
Absolutely. You're all, again, once you cut, you can't uncut. And as we all know, there's everybody will sign that big, huge document of the potential, situations. And some of them are rare, but when it happens to you, that's a life altering thing. You really want to try and avoid it.
Yeah. Well, I remember, I'm from Portland, and Portland Trailblazers were playing the Golden State Warriors, and Steve Kerr had just had back surgery. The head
I
coach
remember
for
that.
the Warriors, and he got on. I watched this interview, and he's like, "I had back surgery," and he wasn't coaching because he was having these headaches associated with the bleed in his spinal cord. But he said He said, "I would never have back surgery." He said, "Rehab, rehab, rehab." And that's the message, is like, let's get to some non-surgical spinal decompression first, and let's see where that takes us. And the research shows that within 6 to 8 weeks, people are, 86 to 92% improved.
I've seen a favorable outcome. Yeah.
The outcome's great. So that's why we like to do this. Tell us a little bit about this. You had a patient that you had some pre and post MRIs, I believe. It was published. Can you talk about that to people?
Yeah. It's kind of a wild story. So I had this is a patient. He actually lived in Canada and he had heard about me and he came down to see me. A patient of mine knew who he was and had told him about me. And he had really bad sciatica. I mean, just excruciating. About 50 years old and just radiating all the way, down to the big toe. And he had seen chiropractors, I had flexion distraction work, had drop table work, and seen physical therapists, physician, everything. And unbeknownst to me, he knew a gentleman named Dr. Terry Yoakum, which in the chiropractic world, he's a god in our world. I mean, every chiropractor,
He's the godfather.
yeah, every chiropractor on this world in this world knows who Dr. Terry Yoakum is. We all had his book. I mean, he is royalty in our profession. Matter of fact, his book is a recommended textbook in over 100 medical schools in our country. And I'm not sure he still is, but at the time, he was a professor at one of the medical schools in radiology. I mean, so this guy is
Hmm.
something else. And um, all of a sudden, one day, my staff says there's a Dr. Terry Yoakum on the phone. I'm like, excuse me? And so I get on the phone, and hello, and he goes, he literally says to me, he goes, "What the hell are you doing with this patient?" I said, "Well, I'm getting him better, sir." And anyways, this was somebody that he knew. He had sent all over the place. He had done. I had seen the pre-MRI, but I didn't know that Dr. Yoakum even knew him. When Dr. Yoakum had talked to him and heard he was doing so much better, he sent him in for a post MRI. And Dr. Yoakum, in his vast years of experience in writing a textbook, he says, "I literally have never seen something this dramatic." And it's kind of a funny story. He says to me, he says, "We're gonna." I mean, and you've met Dr. Yoakum. He is like,
Oh yeah.
oh man, he is eccentric and very just fired up, and passionate, and he's like, we're gonna do a study on this, and he says, you're gonna have your name in the book with me, and I'm thinking, oh my goodness, I'm gonna be immortal with Dr. Yoakum. So, anyways, we signed the papers, and I send him all the stuff, and about 4 months later, I get a call. It says, Dr. Thane, Dr. Terry Yoakum's on the phone. I get on, hello, sir, and he goes, "I'm calling to apologize." I said, "Apologize for what, sir?" And he says, I had my postgraduate students, complete the study, and they accidentally submitted it to peer review without your name involved. And I'm like, oh, this close to greatness. So, anyways,
Hey, well, it's still great.
it's still
It's
great.
still great.
Yeah,
That's why we're doing this video. We'll capture it.
there you go. So, anyways, he came to Seattle. I got my picture with him and the patient. He signed my textbook for me. But the beauty is
I love it.
that patient, his passion. And here's the thing, and we always talk about people, people don't come in to see me because they have pain. They come in to see me because that pain's keeping them from something that's important, whether it's spending time with their grandkids, whether it's hiking or biking. For this guy, his passion, one of his
Hmm.
true passions, was table tennis. And by the way, don't ever make the mistake of calling it ping pong to an advocate table tennis player. I did that and got my butt chewed. But he actually sent me the coolest video. He is just, I mean, just bouncing back and forth, and he couldn't do that. And this was a passion of his in his life. And we restored him back then. He was forever grateful because he was able to go back to that thing that he loved to do. And that's again, and I know as a chiropractor, we help restore people back to those things. And that is priceless. Being able to get back
That's
to
the
doing
mission
things
right there.
that you love.
Yeah. It's funny you bring up table tennis because my daughter always goes, "Want to play ping pong?" We've been playing a lot of ping pong lately, but let's call it table tennis. It's so fun. It's just relaxing, fun, it's therapeutic. So that's interesting. You get these people, they got I call it a motivating factor. Something's motivating. And maybe you could agree with this or not, but they usually come in because they can't sleep. And I just had one who'd actually went for back surgery, super skeptical, been all over it. Her back surgery, no change, hadn't been able to sleep for a year,
Oh,
like
geez.
regular, like an hour or two, maybe. So, first decompression session, it was hard to get her to commit to care with her husband. He's skeptical. She did her first treatment yesterday. She got off the table. I saw her. She was smiling. I go, Did you notice a change? She's like, "Oh, yeah." I go, "Did you almost fall asleep?" "Oh, yeah." And her husband was kinda like, "Rah," and I went up to him, I go, "She's feeling better. She almost fell asleep. Game changer." And he just looked at me like, "Ah, we'll see." And I'm like, "She's already getting better." I mean, and you could probably attest to this, those people that they get off the table, they feel different, and they felt like they're gonna fall asleep, and it's just like, "Wow, this is it."
Well, and for those people where they do feel something right away, I'll tell everybody, if you're feeling something in the first 2 or 3 visits, it is it it's almost guaranteed you're going to have an extremely favorable outcome. Um, and
Yeah.
I always like to set expectations with patients to let them know that that's not usually the norm. I mean, usually it does take a little bit to rehabilitate tissue, but Boy, I'm so excited when I hear what you just share with me because
Yeah. So have you seen patients, let's say, people come in, they come in, they're in pain, and you work on them and they're out of pain and then they disappear. Do they ever come back and see you? Or what happens there? Like, did they continue to get better in your experience? Because people ask me that all the time. Is it going to last? How long does it last? Do I have to come
that's
back?
that's one of the wonderful things I try and explain to patients is like, here's the beauty of this. This is not just a band-aid. And that when you understand, I use the word imbibition, which means fluid flow in and out of the disc. This is, and I used the word earlier, habilitative in nature. You are literally improving the integrity of the disc structure, the annulus, and also, by the way, the facets, the capsules and the facets in the back. It is
Hmm.
forcing
Hmm.
fluid flow in and out, which is helping the tissues to rehabilitate. So it is long term. And here's another cool thing. If you've ever had a broken bone, they put a cast on it for how long usually?
6 to 12 weeks.
Usually 6 to 12 weeks. And when they get that cast taken off, are you fully healed? No, there's still healing that happens. When you've gone through your 6 to 8 week or 10-week protocol through decompression, when you get done, there's still a lot of healing left to do. Discs are in the category in our body of being the slowest healing tissue in the human body. It is in that category of the slowest type of tissue that heals. And studies have shown that full rehabilitation takes 12 to 14 months. So even when you
Mm,
finish your 6, 8, 10-week protocol, there's still a lot of healing that's going to happen. And just like when you take the cast off, there's a lot of rehabilitative stuff that happens, and you will
yeah.
continue to see improvement. I like to tell this story. It's funny you brought that up. One of the most skeptical patients, one of the most skeptical human beings I've ever met. He was from Russia, had severe sciatica. I mean, couldn't sit, couldn't sleep, all that stuff, and had been everywhere. And at the end of his protocol, he was sleeping, still having some pain. He was about 50, 60% improved, but he was able to sit. He was able to walk comfortably, still having some pain though. Uh, we followed up with him for a couple months. And I'll never forget this. I walked in the room. He's standing over the car with his arms crossed and just a scowl on his face. And I walked in and I said, good afternoon, sir. I said, how are we feeling today? And he looks at me, he says, I hate to admit this, but I feel really good. And I just, I was kind of dumbfounded. I was like, well, I'm sorry you're feeling better. But yeah, that was just a great example of, give the body more time. It's a slow healing tissue. Even when you finish, again, I always like to set parameters with patients. You're not going to be 100% better. Some patients are. And that's, again, the miracle thing.
That's a miracle.
This is rehabilitative. The tissues are healing, they're strengthening, the integrity is improving, the functionality is improving. And as you do your exercises and you start to move, you're going to stimulate more natural circulation, which is going to encourage even further strengthening and healing. And you're on the swing up instead of the swing down.
Yeah. I was doing a podcast earlier with this guy. They're doing blood flow restriction exercises with bands, which is pretty interesting to look at for people who have disc issues. So they need to exercise, but they can't. So these are lighter exercises, but they get the physiological effects of exercise, which can help with bone density, blood sugar, all these things. And they can do a workout in 3 to 5 minutes and get all these massive benefits. So
Wow.
it's pretty amazing what we can hack into some of these technologies to really help people get better and holistically, if you will.
You know,
So, Dr. Thane, anything else you want to share with our listeners today?
what I would just say is if you're hesitant at all, please find somebody who is certified, somebody that really knows what they're doing, and have a consultation. Every one of the doctors that I know at Disc Centers America will be more than happy to review your MRI at no charge, to have a consultation with you just to see
Yeah,
if you're a candidate. Unfortunately, there are people who are not candidates, but at least find out if you are. And definitely go to
yeah,
the Disc Centers of America website. It is robustly full of a lot of knowledge, studies, information that can teach you a lot. And
yeah.
man, I just can't implore you enough. I've seen so many people's lives change. And, let me share. I'll end with this. In my career, 39 years, I had a lot of things as a chiropractor where I saw miracle things, and I had patients that just life changing stuff. Where their debilitating headaches went away. They started able to sleep, like you said. Those are big things. Their energy levels were restored. All sorts of wonderful things. But I had in the 20 years of my decompression, particularly the last 8 years that I was involved with disc centers, I had three people come up to me, and I'll share this one story. It was an elderly woman. She was in her mid 70s, and her passion in her life, she would travel with a group of her friends, and they like to go to casinos. And we were talking about that earlier. And she wasn't a big gambler, but they would go as a group and they just have a blast and do the slots and just have a great time. She couldn't do that because she was in so much pain. She couldn't sit on the plane. She was not comfortable sleeping. She had, her energy, just the whole thing. She'd been everywhere. She was referred to me by another doctor of chiropractic. And, uh, you know, she is traveling now with her friends. She's smiling. She comes in. She is like 95% better. She still has a little bit of pain every once in a while, but her life is restored. She's back to doing the things she loved to do. And she's after about the third month, she said, "I need to talk to you, Dr. Thane." And I said, "Sure." And she said, "I want to share something with you." And she looked me in the eyes and she said, "You were my last hope." She said, "If this didn't work, I was going to take my life." And
Wow. Yeah.
don't let it get to that point. You know, and this poor woman had tried everything. And fortunately for her, her chiropractor had heard of me, referred her to me because what he was doing wasn't addressing that disc. And we were able to, literally save a life. And it's a sheer joy to, I recently retired, but it was so much fun. Every time she came in and tell me about we're going to Chicago or we're going to Minnesota, all these trips she was
Mm.
taking with her friends, and seeing the ear to ear beaming smile, and taking somebody from that kind of position. So please, if you're having troubles, get in and see somebody. Dr. Dreiling's in your area, definitely get in and see him, and you'll be taken great care of.
You know, that's awesome. I want to kind of piggyback on that. I was reading a book, Spinal. The lady had like serious headaches and went to all these different doctors, and the doctor she went to is a chiropractor, and he looked at the patient. He's like, "I don't know if I can help you." And the patient looked him in the eyes and said, "Won't you at least try?" Boom, there it is. So I just tell patients, won't you just at least try this thing before you end your life? Because like I can tell you story after story, just like that, of people that say, "You were my last hope." And it's like, I'm so glad we turned the corner and you came in. But I wish we could get a hold of them first.
Yes,
That's why I do this. I want to get a hold of them first.
first. Yeah.
And if you know somebody suffering, tell them, "Hey, try this. Just go."
There,
And if it
there's
doesn't work, you're not going to be scarred. You're not going to be altered.
yes, no injections, no surgery, no cutting. Yeah,
Yeah, there's no downside to it. If it doesn't work, it doesn't work. But if surgery doesn't work, you could have some serious complications. So,
absolutely.
and anyway, so yeah, so I mean that's why I love this stuff. We could probably talk all day about this. So I got to let you get back to the BJ Palmer's historical lot there in Sarasota, Florida.
Yeah, let me show you this a little bit. See that? Oh, that's what I've been looking at when I've been talking to you. Isn't that gorgeous?
I love it, love it.
I'm
Yeah,
loving
come on
life in
now.
Florida.
Yeah, look at that. Yeah, I'm gonna have to come down and visit you
Oh,
because
that
it's
would be
40
great.
degrees up here in Washington, where you came from.
Well, it's 82 today and gorgeous.
Beautiful. Well, that's awesome. Well, Dr. Thane, I really appreciate your time sharing your knowledge, from the last 40 years of being in clinical practice. It's an honor to interview you and pick your brain a little bit and just share some wisdom. I always learn so much from people I interview, and I wish you the best with Disc Centers of America and helping them educate more doctors and help save more lives, and get people not being this as a last resort. So I really thank
Absolutely.
you for your time, Dr. Thane.
Appreciate the opportunity. You have a great rest of your day.
All right. Well, good. I'll look forward to seeing you soon at seminar.
Sounds good.